Okay, well, so I think people will continue to jump in, but in the interest of just moving forward with what we have, let's get started and walk through the various ideas. So the purpose of this collection of folks was to start to pull together the various ideas and see where there's synergy, try and get an understanding of where priorities are, and what are the practical elements that we should consider. We have a few folks on here with some more direct knowledge of how these tests and these procedures and things actually happen, and that can inform the volunteer work and enthusiasm happening in the DIY community. This is just really a teaser. I expect that if we feel that there's excitement, who is Steve? Yeah. So if you wouldn't mind, I'm going to mute you. Yeah. If you, it's to get people coordinated around the around all of this work. So what I want to do is I want to first have just two folks introduce themselves who are representing sort of institutional levels, and then we'll go through each of the different projects and just hear a little bit about what you have to say about your project and what sort of resources you could use. I actually wrote up 4 specific questions if you want a little more guidance. That is on the event page, and you can walk through those. I'm just letting people in. Walk through those if you feel you need a little more walkthrough on those. So just to start, so it's Andy is from Yale Hospital and might be joined by a colleague, and Jamie's from the Manufacturing Association, which I think is sits beside the DIY community. So I know that they're activating. And Jamie, I wonder if you could just say a couple words about what's happening in the local manufacturing world, and then we'll jump over to Andy.
And this is Lattanza. I just joined.
All right, thank you.
So manufacturing-wise, we got the exemption from the governor yesterday. So manufacturing is fully up and running right now. The manufacturing community is working on a lot of critical requirements right now. So the governor exempted manufacturing because they understood the importance to the economy. That was thanks to David Lehman and our chief manufacturing officer, Colin Cooper. Manufacturers, in some cases, retooling. There are manufacturers that are making critical supplies, like Modern Plastics right now is making the clear face masks. We have a company called Mask Seals that was a startup, essentially, I believe, sort of a makerspace type concept that does reusable self-adhering strips onto masks. They had a manufacturer in New York that they were going to work with. That manufacturer was shuttered because of the requirements in New York. But in Connecticut, since we can manufacture, we're working with partnering them with some of our in the manufacturing community, and we think we have somebody that can actually help make their product as of today. So the manufacturing community is certainly very much involved in this, and it's a continuing evolving situation. But we do have the issue with manufacturing staff to make sure that they have access to get to work. Believe it or not, some of them have already been stopped, even though the order doesn't go into effect until 8 o'clock tonight. The manufacturing community is providing letters to all their employees. Again, these are critical employees, so not office employees, but folks that are in the manufacturing and the shipping side of things, to make sure that they can get to and from their places of work.
Yeah, and I think one thing that we're thinking about is where individuals can very quickly and rapidly respond in small volumes, where the manufacturing apparatus might take a little time to implement. So I think ultimately it's probably that apparatus that takes over for most of these projects, and we look forward to that.
Well, and that's why that Mask Seals, for example, that was just 2 women that came up with this idea, and they needed to get it into the manufacturing process. So we're involved in many different steps, including that 3D swabs email that you sent out earlier today, I hope that we do have at least one of our 3D printers that has a lot of equipment in Connecticut that is already up to speed that can help in that sense as well. So we can help on different levels, as well as support the makerspace community as needed.
Yeah. And Lisa, I think you said you were willing to talk a little bit about the situation at Yale New Haven.
Yeah, and I can talk specifically about Yale New Haven as well as sort of around the country, but our issue right now is that we already are at a shortage for personal protective equipment, and that includes the N95 respirators as well as regular surgical masks, face masks, OR caps, and gowns that we need to be able to wear to work with patients that either are positive for COVID-19 or being ruled out for COVID-19 before their test results are back. The number one thing is the N95 respirator masks. These are the masks that filter droplets and aerosolized particles, so whoever's taking care of the patient doesn't become infected. There's a supply chain issue because this is a worldwide problem. And so what we're trying to do is come up with an alternative, because it's not really a question of if we're going to run out. It's likely a question of when we're going to run out based on the supply chain, unless enough companies start production that haven't been doing it previously, or the companies like 3M that have always done this start producing more masks more quickly. So I am part of a task force at Yale that's looking into alternative masks to the N95, and this has been ranging anything from the homemade cloth mask that will never replace an N95. We can use that in other areas, but we can't use it with COVID-19 patients. And then I also had a meeting today with some of the engineers at Yale to discuss the possibility of 3D printing masks or producing acrylic masks that could actually be sterilized again. And the 3D printing of masks and the sterilized masks have not been, or the acrylic masks, none of this has been tested and vetted to the point where we would be comfortable putting it on healthcare professionals and sending them into a room to take care of a infected patient. So that's some of the challenges that we have, is kind of a fast enough turnaround time on some of these unique ideas to be able to get them back and test them and then start manufacturing them. So that's sort of where we are.
All right. Well, thank you for that overview. So the plan is to jump into the dialogue with each one of the individuals, and I'd put initially 10 minutes, but it's certainly I welcome shorter than 10 minutes because we have a good number of folks to get through. So it's just enough to get the idea across. We do have, I see people have been chatting on the event page where we put up a live chat, and some people are having trouble with the live stream. And so a lot of them are joining us in this chat right now. So hopefully, just as folks come in, let's try and mute so that we don't get too much overlapping chatter. I'm not quite sure what happened with the live stream. So why don't I go just to the first one on my list? And if any of the presenters have a time constraint where they're going to have to jump out, pop in and let me know so that we don't miss out on you. But let's start with Lior and Kate talking about what you've learned about sewing face masks.
Hi, all. My name is Lior Justman. I'm the shop manager here at MakeHaven. And I am, as well as I'm sure many of you, have learned more about masks these past few days than I ever thought I'd know. I think that it's gone in a bunch of different directions with the city's shortage, with the hospital's shortage, but also a lot of other kinds of PPE that are important. There are a lot of different kinds of masks. So with N95 being the most intensive one used commonly, though it isn't at certainly the highest level of filtration available. Then surgical masks, which can protect both the provider and patients, can also be put on the patient to protect providers, and as well as other masks underneath that. So I'm just going to kind of combine the two projects. I think that, well, sure. So originally I had sort of dismissed the idea of making cloth masks because they are significantly inferior to what's commercially available, but what's commercially available is not available. And a lot of organizations around the community are interacting with the public through soup kitchens and other forms of aid without any form of protection. And while cotton is not HEPA, it's not melt-blown polypropylene, it's not, copper laden, it's not any of those things. It is significantly and proven significantly much better than nothing. Most of the droplets that are coming from patients are bound up in water. It's not, a 200 nanometer particle, so you don't need to put it through a HEPA 14 filter. Just, a few layers of cotton is enough to grab a lot of the water-bound droplets. So to that end, we put out a call for people to make masks at home. We found designs. There are a lot of people all around the world putting together designs that have been vetted by healthcare professionals and engineers and you name it. One group in particular that has been particularly good is it's centered on Facebook, and they put together documents for all different kinds of PPE that people can create. They vetted designs, and that's where I pulled a lot of this information from. People have proposed all different kinds of materials, which is great. At the end of the day, 100% cotton is kind of what we're looking for, though some studies have shown that cotton blends are superior. So for this distributed effort, whose target population is people in the community and individuals, for their own protection when they have to go to the grocery store or other needs like that, we're recommending, cotton blend or cotton, preferably 75% or above cotton. And we have designs. It's a 3-pleat model, so it has a little bit of facial conformity. You can put a metal tab inside of it to help bridge the nose. And that both protects you, and should you be contagious but asymptomatic, that would also help protect others around you. So yeah, the design we shared on Facebook as well as on Slack for MakeHaven members. It would be exciting to share this more broadly so that other individuals in the community can help sew masks for themselves and then drop them off at MakeHaven, or they can leave them on their porch and we can come pick them up. They can be washed. So there's been conflicting information on whether these are helpful as covers over masks. The CDC does recommend covering N95s to prolong their use, even though the degradation of an N95 normally comes from the humidity from someone's mouth. Just clogging up, it gets hard to breathe through something that's water laden. If a patient were to spew germs through an intubation or something, it's better to throw away a cloth mask than throw away an N95. There was other information from Yale saying that viruses could get trapped in between. In my mind, the outside of the N95 is a dirty layer, so it's okay if viruses are trapped there, but I may not have gotten the full picture there. So maybe the city, which is also really short on masks, could use cloth to cover their N95s just to prolong their use. Though just to clarify, if they're not getting clogged by viruses. The viruses are wildly microscopic. They can, the mask can be put in a paper bag and let dry between shifts. So there's not really an issue of the N95s clogging. They can degrade, and the seal around your face can degrade, and that would be cause for throwing them out, or if bodily fluids were to knowingly be gotten on them. Kate actually was able to make a mask yesterday, and I was hoping she could just show us, tell us how that went, and any insights from that process.
Sure. Hey everyone, I'm Kate. I'll keep this pretty quick, but I am a very inexperienced sewer, I would say. A little bit of home ec in middle school, that's about it. But I did get some patterns. I think Lior has created a great resource of some different research patterns, and we are looking for people who can help. This is an example. Here's a cloth mask that I made yesterday. This I actually got from Joann's. Joann's is giving out free kits while they have them for people who are willing to donate their masks. They're working with United Way, which we are as well. So that's fantastic. So this is what they look like. There's a few different models, as Lior said, but they're pretty basic, and someone with very little sewing experience was able to quickly learn how to make some pleats and put this together. So I want to share a couple links, which I'll put in the chat as well. MakeHaven.org/sewmask, SEWMASK. That is where you can volunteer if you're willing to sew a mask, or if you have a sewing machine, if you don't have time to sew, but you have a sewing machine that you could let someone else make masks on, anything like that, any way that you can help out, please go to makehaven.org/SEWMASK, sew mask to volunteer. And then also, if you are looking for the information that we have compiled, you can go to makehaven.org/maskinfo. And that is where we're keeping all of the patterns and various reviews and things like that we've collected. So I'll put that in the chat for everyone, but that's what I have.
And I'd just like to jump in quickly there. At MakeHaven and a lot of other communities, there's been a lot of talk about different ways to make masks of like the low purification quality. And involving, I think, a lot of people's instinctual response is thinking about 3D printing, because that is a rapid prototyping technology that seems appealing. It's also porous and has a low melting point, the plastics that we typically print in, which is why that is often ruled out. And in terms of other materials, the balance that is difficult to get is both breathability, being able to pull air through it, and having a good filtration. Something like a vacuum bag would get better filtration, but if you can't pull air through it, the air comes in through the sides, defeating the whole purpose of it. So that's a pretty tough balance to strike. The proper material is a melt-blown polypropylene, which is very expensive and difficult to make. And that strikes that balance, having a non-woven polymer structure that is able to pass air and capture particles simultaneously. So that's kind of how we've ended up where we are.
And one thing I just do want to add is that we are working, like I said, we're working with United Way. We're also working with Downtown Evening Soup Kitchen. We're looking for community organizations, not hospital-based, as we heard earlier, but community organizations like soup kitchens where they have a need. You know, Desk has asked for at least 100 masks if we can get them. So we are working with different groups. If you have a group like this that has a need, definitely be in touch with us as well.
Well, thank you guys. I think that puts us in a good spot to go to the next one. And I'm going to ask that any questions get held to the end, just so we can get through as many of these as possible. And so we had Aaron. Are you there, Aaron?
I don't see Aaron on the...
Okay, we're going to skip Aaron for now, and we're going to go to Joel Greenwood.
Wait, hey, can you hear me?
Oh, yes. Now we have...
Yeah, I'm here. I just don't know if I can present.
I just didn't see your name. I'm sorry.
Yeah.
It's Glowworm. I'm using, this is, yeah.
So, Aaron, do you want to just give a brief synopsis on what you're working on and how people can help? There's some specific questions on the page if you need some from it, but just a brief overview.
Yeah, so the brief overview would be, we're trying to look at ways to refurbish, and it's a terrible idea, but refurbish N95 masks. And I was looking at how they're built, what they're manufactured out of, and how you could chemically sterilize those and reassemble them. And it's really just not feasible. I was reading all the CDC guidelines. There's a lot of documents that Lior had posted on the Slack channels, and I was reading through CDC, Yale guidelines, and there was another one from Nebraska Hospital. And there's the definition of extension of an N95 mask is just to be given one and wear it the entire shift and don't take it off. And that's the definition of an extended N95 mask. And a reuse for an N95 is to carefully take it off, examine it, and if it fails any of these checkpoints, you have to discard it. But in all of those guidelines, there was a suggestion on how you can increase the probability on reusing a mask. And it was to cover the respirator with a procedural mask and wear a face shield. So what I'm trying to do is come up with a way to manufacture face shields and provide them to hospitals. And because they'd be going to hospitals, they would be under more stringent requirements. We'd have to follow their guidelines, figure out what they would be willing to accept. But that doesn't mean we can't still move forward with this and provide to the community outside of hospitals. And I think what we're looking at now, it's evolved quite a bit, but currently we're looking at either using a die cut, a laser cutter, or the water jet to cut acrylics. And there's three parts to this. It's just the clear plastic, some sort of foam connector, and an elastic. And there's already a build out there. I just have to talk with some sort of hospital rep to see what their requirements are, like what manufacturing practices they would need, what kind of record keeping they would need. But essentially it would be fairly simple just making the stuff. And Bruce, I want to get his name right, Bruce Crowder has been 3D printing these face shields. And although the hospitals don't want the 3D printed parts, he suggested these transparency sheets that we wouldn't need to cut. So that might bypass the need for the water jet, the need for the die cut or the laser cutters, if we could just buy these transparent sheets, and if that would be acceptable for the hospital systems. And I haven't gotten an update yet on MCC, but my sister's an OR nurse, and she's been talking with her materials manager about this, and they're interested. She says she's got some news to give me. She can't go into specifics, but just to keep working on the project. So that's basically it. We're going to do vacuum forming. We're going to do a lot of other stuff, but it seems to just be a lot simpler to follow an already established build, and it's very simple just to put them all together.
So was there anything specifically you need from the community to take the next steps in figuring out what you can do here?
Well, I would need to talk to someone at the hospital to figure out what their requirements are before we start producing these things.
I'm happy to be that person.
Oh, hi. Lisa?
Yeah.
Okay, well, can we touch base offline after this?
Absolutely.
Great.
Well, thank you, Aaron. Why don't we move on to Joel and hear about what he's been working on in his lab?
All right. You guys see me?
Yep.
Okay, so what I've been doing is trying to coordinate with several different groups at Yale to try to pick whatever low-hanging fruit we can in the same realm, the sort of, what can we make fast to fill the gap before production runs spool up. And so then it seemed like the lowest hanging fruit was the face shield because it's significantly easier than the face mask. And it was something that I thought that I'd actually be able to make. And so then I started a print last night. And this is just the Prusa version 2 face shield, nothing fancy. But this is something that, unfortunately, I think a lot of us are going to end up wearing face shields. And so we're going to need more of them. They're pretty easy to make. And so then I was just trying to source materials and make as many as we can.
Great. And is there any assistance or things that you hope other could do in parallel or with you to help your effort advance?
Yeah, so today was sort of my first day in charge of a team that I don't even know who's on it yet, and so I'm just trying to figure out what resources I have before I ask for more resources. But the nice thing is that the person who's coordinating a lot of this has a team of medical professionals that are willing to evaluate and give feedback on things that we come up with. And so then if you guys have anything that you think could go to the hospital, I have a mechanism for people to evaluate that if you want, although it sounds like Lisa may have the same connections.
Great. Well, thank you, Joel. I think we're going to jump over to Stephen Robinson now, who's going to do a full introduction tomorrow about his project, but we get a preview now. Stephen, are you there? Saw him earlier. Are you muted, Stephen?
There you go. There you go. I was struggling with unmuting myself electronically, at least. Okay, so nice to see you all. So what I did was a few weeks ago decided to just explore what the technological challenges would be for somebody to try and make a ventilator system. Now, just to be clear, what I've got here is a prototype. It's not a medical device per se. It would need a lot more things to be done to it to enable it to be that. But in the event that ventilating devices would not be available in the supplies that were needed, either in a location like the US or the UK, or maybe more likely in developing world where access to manufacturing facilities is not as readily available, I wanted to start exploring that. So this is the test version I've got. I could fire it up if you want me to, or maybe you want me to wait till tomorrow to do that, JR.
Oh, I mean, if it's easy, fire it up.
Fire it up.
Let's fire this baby up. Okay, so keep calm and carry on, everybody. So anyway, here it is. It's basically powered by pneumatic air. I've got basically a pneumatic tank over here that would need to be replaced with a proper air source in the sense that it needs to be cleared. It has 3 valves, valves that controls the input to bags, which are in fact bags that you normally open a car door with if you want to break into that car. Well, there were bags that I found that sourced, which would be able to be very durable. And then it exits the air through this into this wonderful patient here, this little red bag. And then it exhausts that back through there. Everything's controlled by an Arduino processor, and has a 12-volt power supply down here, which could be a car battery. So let me fire this fella up, see if it starts working. Okay, so actually I'm just going to turn the pressure up a little bit more. Da-da. There you go. So what's happening is the air is coming in here. It basically exhausts to this. This starts venting, and then it can take another inlet pressure whilst this is venting. So that's kind of what it is. There's the UK has a set of checks for ventilators that they're looking through as their specs. I've posted that to the top of the GitHub project, where I basically put more information about this, and I could link you to that. So I'll just turn it off because it's kind of noisy. But that's basically what that is.
Great. Well, impressive. Thanks for sharing, Stephen. And those that want to know more about the project and what's going on with it can tune in tomorrow. But do you have a short version of any sort of resources or anything that you need, or blockers that are stopping you from advancing?
Well, I mean, I think there's one blocker, which is, you know, I have a job and whatnot, so I can't devote myself full time to it. And the other would be, I think there's, you know, that's sort of part of, are people interested in something like this? Can this provide input to what they're doing as a start point, as learning from this and where it could go next? There's a lot of ideas that come forward from this. But also, you know, part of any project like this is also going to tee up questions around sourcing components for systems like this or other systems. You know, if you went to Amazon last week, you could get all these components delivered in 2 days. Now it's a week, and who knows how long it will be beyond that. So there's a lot of supply chain dynamics that I think people that are looking at this kind of project have to be aware of.
All right. Well, thank you, Stephen. I look forward to hearing more tomorrow. Anne, are you there?
I am.
Anne, do you want to just share your perspective and the needs that you have in your experience, your lab?
Yeah, sure. So I'm an associate research scientist from Yale School of Public Health. I'm currently part of the emergency response team we have here for COVID-19. I'm lab-based. We are currently trying to get a number of studies in place. One of them, importantly, sampling healthcare workers at Yale New Haven Hospital. We want to be able to test them, test them for COVID, to see how they're doing, making sure that they're healthy, that they can remain on the front line, and that they're not potentially carrying the virus or spreading it to each other or to other people. And we're also wanting to do more outpatient sampling as well, with the idea that we'll be able to get results back to individuals same day or early next day, compared to sort of results which might take 2 weeks from places like Quest or other diagnostic labs, with the idea that if we can really identify people who are positive as soon as possible, we can really make sure that these people are self-quarantining, and then we can also reach out to their contacts and do contact tracing and just really, really help slow and, stop the spread of the virus in the community. So this is all in place, ready to go. But of course, with the massive outbreak that we're seeing, we've been advised that swabs are incredibly limited. So we have virtually no swabs available to do any of this testing. We're trying to sort of scramble around, see what swabs labs do have, trying to find some companies that do have swabs, who's willing to donate, who's willing to share, but it's very limited supply. So one thing we have started looking into as of today is the possibility to 3D print these. So there is a link on the page for today that takes you to a GitHub repository outlining the making of these swabs. This has been put up by Harvard, I believe, and is what they're sort of starting to look into. It is quite a specialized swab that we need. It's a flocked Ryon swab, so to really help sort of grab the cells that we're after and to make sure that we get a really good sample from the individual. So it is looking like it could be possible to 3D print these. So we just got in touch with MakeHaven, as well as reaching out to all around Yale, just anywhere with 3D printers, just looking for anyone who may be able to help even see if making these is possible and if we'd be able to use them rather than waiting for what might be weeks from the distribution companies around the country.
Great. Well, thank you. So that's a call for some help, and there might be some folks on the line here who will be able to direct you to resources that we're not yet aware of. So hopefully we can solve that. We have one last one that has been submitted in advance, and that's Jonathan talking about food distribution. Jonathan, are you there? We have Jonathan. All right, last call, Jonathan. All right, so I think the next part of this is to open up for some discussion or any sort of feedback. Where I'd like to start is on the page. We have a chat, and so I'm going to check to see if there's any questions, and others can feel free to take a look at that and see.
Could I jump in with a question for Anne?
Sure, question for Anne.
So I read through the GitHub repository for the swab, and making the components seems pretty trivial, but the crucial element is that all the materials used need to not react with the PCR process. And they don't list that the materials that they listed, so there are no glues yet found to attach the flocking material to the swab that don't affect the PCR. They found tape that works, but tape obviously isn't going to work in this situation.
Lior, but it sounds like you're underwater a little bit, Lior.
Yeah.
I'm sorry. I can try to speak up if that's helpful.
That's better.
Okay.
Yeah.
So, sorry. So the main roadblock in my mind is finding materials that are PCR neutral, polymerase chain reaction, which is what you have to do with, obviously, yeah, whatever. So that's the crux in my mind. I have no way of testing that, and it isn't on the document from Harvard. So I think once we figure that out, then we can get the adhesive, we can get the flocking material, and we can make swabs. But that's a pretty big hurdle.
So we actually also have, I believe Cheney is also on the call. She's been looking into this extensively with me today as well. I think she's got some information on that as well.
Hi. So we have kind of a list of characteristics we'd want to test in performance and safety testing, and like you mentioned, the non-reactivity with PCR is a big one of those. And so we have some RNA standards, and we have that we can use for that. And we've been, in order to sort of develop the screening assay, we've made sort of mock samples. And so our idea would be to use those for initial prototype testing, and then as we phase these in, we have a limited number of traditional swabs that we're using now. So as we phase these in, we would get 2 swabs from patients, one with traditional, one with our swab, and make sure that they are working just as well. And so the other things we definitely want with performance testing is that we need to make sure it picks up enough product. And the Harvard page, the GitHub page, actually has a little section on testing where they suggest their way that they're sort of testing theirs. And it is, let me see if I can send it in the chat right now. And so what they're doing is they're basically doing an oral swab and then checking under microscopy, just because the logic being that that's very fast. And if you can pick up bacteria, you can probably pick up viruses. I don't know whether that holds to what extent it does. But again, before switching over to these, we would definitely do non-inferiority testing alongside the traditional products. And yeah, and the sort of final thing that we would definitely need to test for is that these have similar material properties, because NP swabbing is an invasive test, and we want to make sure that the material that we use will be at least flexible enough to not traumatize airways, and we have a few ideas for testing that. We have some sort of dummies with airways in them that we're planning on using. So
yeah,
if you have feedback on that.
Sure. Yeah. So FDM is the fastest printing methods are just going to be a traditional 3D printer that squirts out plastic. That has some texture in it, so it would probably tickle, to say the least. Mm-hmm. Even if it had the flexibility, which it might.
Well, Peter, can I jump in there real quick?
Sure.
Yeah, I know for flexibility, there's a TPU that might be a bit too flexible, and then there's PETG for the filaments, but I don't think FDM is the way to go here for this. I'm really worried about the abrasiveness of those sticks.
So from the design, I have minimal 3D printing experience, but from looking at the design, it looks like the direction that people have been moving in is not trying to actually recapitulate filaments, but just designing a different head that won't traumatize the airway and still picks up enough product. So that's, I think, the sort of performance testing aspect of it. So yeah.
Great. So yeah, I mean, so it sounds like. Do you want to have this conversation? Would you be interested in having this conversation separately?
Yeah, absolutely.
Yeah. Okay, so maybe we should arrange that.
Yeah, I think we can kind of move on to other things, but we can connect outside of this.
Great. Awesome. I'm looking forward to it.
Yeah. So, and people feel free to put your questions in either of the two chats if it's difficult to, speak up. So we have one from Elise. Can cloth masks be hand sewn effectively for those without sewing machines?
Yep. Yeah, you can totally hand sew. It's just going to take a little longer. If you're making masks for someone else and you're hand sewing, it's especially important to wash them afterwards and bag them after your hands have been cleaned, just so you aren't passing anything along to anyone else.
Great. Other questions for any of the folks?
I have a question for, I'm sorry, it was Lisa. Yeah. Is there a world where the hospital needs non-approved ventilators, non-standard ventilators? Is that not on the horizon, even in the worst case scenario?
Had to turn the mic back on. I hope and pray that it's never going to get to that, but I don't think we know really.
Sure.
Yep. I will tell you that New York Presbyterian Hospital ran out of ventilators over the weekend. I'm sure that they would have used anything they had to not have to make the decision of who got one and who didn't.
Yep. Yep. So I was looking, obviously, I'm really excited for Stephen's presentation tomorrow. There are also many people all around the world designing ventilators in anticipation of the need. I posted a few of the designs in the chat. Some of them have many, many people working on them. So that it may, I think a lot of groups have been like, no, that's not really the PPEs where we need, but it may be worth, more groups spending more time thinking about that project.
And I can tell you one other thing that the group at Yale Engineering is working on, but I can't imagine they couldn't use additional people. The things that we're running low on are actually the other pieces of the ventilator, the connectors, and there's now a 3D hack online for splitters to turn one ventilator into ability to ventilate 2 or 3 patients. So essentially doubling or tripling the number of ventilators that you have. So there are easier things that can be printed, tubing, the splitters and things like that are also helpful.
Sure.
Hey, can I pop in for a second? It's Rich.
Yeah, quick question. Although we're queuing questions up in the chat, so that's the preferred method. Yeah.
I'm one of the seniors that use a CPAP machine every night, and I can turn the pressure up there, and it'll blow up my lungs like a balloon if I put it up that high.
Yeah.
Is there a way I could inject, make an apparatus that could inject some oxygen into there? So even though I'm not in a hospital, if I'm in my own home, I can turn my CPAP machine into a respirator.
That's a really great question. There's actually some evidence out of Italy because they've had problems with running out of ventilators early on before China brought more in. And some COVID-19 patients, obviously not the worst cases, but there's sort of a middle ground where they were able to use CPAP and keep people from getting worse and keep them from dying simply on CPAP machines.
Yeah. So thank you. So I'm just going to jump back to some of the questions that are in the queue. So might industrial sources of melt-blown polypro be repurposed for masks?
So as far as I'm aware, the melt-blown polypropylene is almost only used for masks or filters. So I would be very, very surprised if any manufacturer of it was not currently retooling and making masks with it. China, as you might imagine, has retooled hundreds of factories to make that the equipment is very, very expensive. If anyone's familiar with electrospinning, it's vaguely similar, but on a huge scale. And it's just a very intensive process.
Okay.
So it's hard to spool up.
So it doesn't sound like there's a additional source. I have another question from John. It's I think this is for Joel. Can regular PLA be used for printable parts with the PERSA face shield? I believe that's Joel and Aaron are both working on face shields. I don't know if you want to jump in on that.
Yeah, sorry, I was just trying to unmute. So yeah, the preferred we need something that can be autoclavable, and so then PET or PETG is the current preferred 3D printable material. PLA, to my knowledge, is not autoclavable.
No.
I just have a quick question about that. Just in terms of the autoclave, is that a heated autoclave, and to what temperature is that going to?
Yeah, this is just off of memory, but I think it's 201 degrees Celsius. So, or 121 degrees Celsius at 15 psi for 30 minutes is a standard protocol. But you can Google that.
So this is Lisa. With regard to the face masks or the face shields plastic, they don't have to be autoclavable. They can be wiped down with bleach.
Yeah.
Yeah.
Yeah, I mean, I would shoot because the time difference for making them autoclavable or not is basically nil as long as you have the material. I was shooting for something that the hospital is comfortable with, but I agree it's totally possible to wipe down a face shield.
Yeah, I mean, that's current practice right now, so hospitals would take them without that capability.
And so I think that relates to this next question from Vladimir, which was asking about if there's a limit for what material, acrylic or PEG, that face shields or other things are made of in the hospital. It sounds like there's not a specific limitation for face shields and the material.
I mean, I guess I would say for face shields, the thing is it can't be porous. But beyond that, there's not as much restriction on a face shield as there is for a face mask.
Great. So Nick asks, what about taking melt-blown water filters and rebuilding them? What micron size is required? Nick, do you want to jump in and explain what you're saying?
I think that question was already asked. Oh, water filters.
Water filters. If Nick's on there.
Well, the micron
you
size.
Can't join audio. Okay.
Slightly less than 300 nanometers. And
so the standard for an N95 mask is that it needs to clear out 95% of particles 0.3 microns or smaller. And larger. So that's the standard it would need to hold to.
All right. Well, are there any other?
Have you considered, Leo? I don't know if you considered the HEPA class E11 material.
Yeah. So it's a balance.
That stuff.
Yeah. It's a balance between how much pressure it takes to get a certain volume of air through it and how good of a filter it is. And my sense is that the HEPA is a great filter, but difficult relatively for a human diaphragm to get air through.
Well, there's one weaker class, and if we're going to just use layers of cotton, it might benefit the masks to have a class E10, which is it blocks 85% of 0.3 micron or larger particulates. So that might be easier to breathe through. And again, you can buy sheets of that as well fairly cheaply. And you could just layer that in between your layers of cotton for the face mask.
Cool. Yeah, let's look at that later.
Yeah.
Yeah. So I think we're at a good point where we've covered the scope of what people have been talking about. We've answered some questions, and we can think about next steps. So share it in the chat and I will add for any of the organizers that would like to be contacted, I'll add their contact information to the initial event page so that folks who want to get in touch with them can get in touch with them. Or if you're going to, you would like to host a session like Stephen is, specific to your project, I also welcome that. We're happy to work with you or direct people to where you are doing that sort of event. So I think this kind of concludes our formal activities. If folks who haven't had a chance to ask a question yet, or people want to stick around and talk a little bit about these options, that's fine. But our purpose was to get the ideas out there rather than get into the details of each one, really just as a kicking off point. Kate, I have a page that includes our project so far. Yes, so Kate has posted MakeHaven / COVID-19 for the existing projects. So those are, that's where we are. I wondered, Lisa, sort of as our representative from the hospital, if there's any closing thoughts you had, unless anyone else had any burning questions before we wrap it up.
Well, I mean, I just want to mention that Ian, he has been mentioning a few times that you can just buy face shields for $15 in Harbor Freight. And if we can just do a fundraiser and just buy them, then that's something that's action we could take relatively soon. It's going to take a while for us to get to the point where we can manufacture a good amount of these. I myself got hit hard with the downward economy, so I really can't donate. So, but if we can go to the community, raise money, just buy the shields, why not?
Just wanted to throw this out there. Harbor Freight. Oh, I just saw someone chatted it. They're donating PPE that they have on stock, every last item, to hospitals across the country. We actually have a request in as of this morning. I haven't heard yet they replied, but it's awful nice of them to do.
Yeah, it's great.
Great. Well, I think we're at a good point. Did you have any last thoughts, Lisa, as you're coordinating, or follow up that people should do specifically with you?
I'm happy to have anybody contact me at any time. If you have questions or need to be connected with people through supply chain, or need to vet your ideas as to whether there's something that we would take. I think by the time we get to this, where people are making things for the frontline providers, all of those things are going to be relaxed. Of course, we want to keep people safe, but some of the stringent things that you're coming up against are definitely going to be less so as we get further down the line and run out of these things. So I would say vet them as best as you can, but it may get to a point where we need whatever we have.
And if I can just add on to what Lisa said, yeah, a project team started yesterday, which is how I got to kind of electronically know Lisa in the last 20 hours or so. We have and I just posted the email address for it. We have a donation site that went up. It's donations PPE or PPE donations at ynhh.org. We've had an incredible outpouring of support from sewing groups and church groups that are following plans found on the internet, that are supported by the CDC to make the hand sewn masks. We're very happily accepting them, because I think, as Lisa indicated, we know that we're going to get to that point, and we'll take what we can get. We're very, very thankful and gracious for it. And we love the ingenuity. I was excited that MakeHaven has this forum out here, getting people thinking and the juices flowing. I'm helping go through all those donation emails. So if you send an inquiry there, I'll definitely see it as well. But very happy to answer any questions too.
And I just want to echo what he said. We're all very grateful for what you're doing in your spare time, or time that you don't really have that spare, that you're continuing to work, but you're thinking of this too. So thank you.
Yes. So thank you, everyone. I think our formal activities have concluded, and I'm looking forward to seeing all that you make and improve as we work together to solve these problems. Thank you.
Thanks. Could Aaron and Lisa, do you want to, and Joel, do you want to stick around for a minute to talk about the face shields?
Sure.
Would I be able to stick around too?